Welcome to The Deep Dive. We're the podcast where we take a whole stack of information, really dig into it, pull out the most important bits, and lay them out for you. Today we're tackling something that thankfully isn't super common, but when it happens, well, it can be absolutely devastating for horse owners. We're talking about equine poisoning. Our mission in this deep dive is simple: to arm you with the crucial knowledge, how to act fast, what do vets look for in diagnosis, treatment options, and, maybe most importantly, how to prevent these awful situations. You're about to get a solid handle on a really vital piece of equine care.
It really is a vital area, and honestly a pretty challenging one too. The complexity in figuring out if it's poisoning and then managing it, it's significant. You really need to make decisions quickly, but also have a solid understanding of the steps. It's a bit like solving a high-stakes puzzle against the clock.
Okay, let's dive right in then. Picture this, the absolute worst case. You think your horse might have been poisoned. Panic is natural, right? But our source is stress. There's a systematic way to approach this. So what's the very, very first thing you need to do?
Right. The key thing in those first moments, the absolute priority, is life over label, you could say. Stabilize the horse first. Figure out the exact toxin later. Your immediate goals are just that. Keep the horse stable and stop them from absorbing any more of whatever the harmful substance is.
Okay, so stabilization first. For you, the listener, facing this awful situation, what does that actually look like on the ground? What are the immediate steps? Well, first up, it's safety, yours and the horse's. That means protecting yourself, maybe gloves, PPE, especially if you don't know what the substance is. Then immediately get your horse away from the suspected source, the plant, the feed, whatever it is. Get them out of that contaminated area. And crucially, you've got to secure or remove that toxic stuff so this horse can't get more and no other animals can either. Once that immediate danger is contained, you pivot to the horse itself, stabilizing the patient. Vets call it the ABCDEs. A is for airway. You got to make sure it's clear, check for any obstructions, remove anything foreign in there. D is breathing. How fast are they breathing? Are they struggling? Listen to their lungs if you can. If they're having trouble, seem short of breath, or their gums look bluish, that's cyanotic, they need oxygen if it's available. C is circulation. Check their heart rate. Feel their pulse. Look at their gum color. Check capillary refill time. If they look shocky, dehydrated, or just have poor circulation, starting IV fluids is really key. D's is disability. That's the neurological side. How alert are they? Are there seizures? Tremors? Are they unsteady, sort of wobbly? That's ataxia. If they're down or convulsing, protecting them from hurting themselves is paramount. And E's is exposure and environment. Keep their body temperature normal, blankets if they're cold, shade if they're hot, and control any ongoing external exposure.
Yeah, and while you're doing all that, the stabilization, it's just as vital to be gathering information. You're like a detective at this point. You need to be asking or trying to figure out, what exactly was it? Was it eaten? Was it on the skin? Inhaled? How much did they get? Critically, when did it happen? How long ago? Are other animals affected? What signs are you actually seeing? And how are those signs changing?
Yeah.
Getting worse? Staying the same? And, if it's safe, try to collect a sample, a bit of the plant, the feed, the chemical container, maybe even vomit or stomach contents if that happens. That info is gold dust for the vet. Pure gold.
Okay, so the horse is stabilized. You've gathered what info you can. The next big thing is stopping more toxin getting into their system. Decontamination. What are the main ways that's done?
Well, the method really hangs on a few things. How they were exposed skin, inhaled, eaten, what kind of toxin it is, and, this is crucial, how much time has passed. So if it's on the skin, dermal, or in the eyes, ocular, you need to immediately thoroughly wash the skin or flush the eyes. Lots and lots of lukewarm water, maybe a mild soap like dish soap. Wear your gloves, of course. And a key point, don't scrub really hard. That can actually damage the skin and counterintuitively increase absorption. Gentle but thorough. If it was inhaled, that's more straightforward but just as important. Get the horse into fresh air, away from the source, supplemental oxygen if possible, and then watch them really closely for any breathing problems.
Right, but you mentioned ingestion. Eating is the most common way this happens, based on our sources. And this is where things get interesting and maybe a bit surprising for some folks. One option is gastric lavage, right? Stomach tubing.
Exactly. Passing a nasogastric tube, an NG tube, and basically washing out the stomach with large amounts of lukewarm water. But the timing is so critical here. It's really only effective generally within the first hour or two after they've eaten it, much later than that, and it's probably not going to help much.
And there's a big warning with that too, isn't there?
Oh, absolutely. You absolutely avoid it. If the horse ate something corrosive, strong acids, alkalis, certain oxidizers or petroleum products, the risk of them aspirating that stuff into their lungs is just too high. Very dangerous.
Okay, so lavage is time sensitive and has risks. What about activated charcoal? That comes up a lot.
Yes, activated charcoal is generally seen as the single most important tool for decontamination when something's been ingested orally. It's this incredibly porous stuff, and it basically acts like a sponge, binding to many different toxins in the stomach and intestines, stopping them from getting absorbed into the bloodstream.
How's it given?
Usually mixed with water into a slurry, and then given through that same NG tube. The dose is typically around 1 to 2 grams for every kilogram the horse weighs. And sometimes, depending on the toxin, especially ones that recirculate through the liver and gut or take a long time to absorb, you might need to give repeated doses.
But it's not a cure-all, right? It doesn't work for everything.
That is absolutely vital to understand. It's not a magic bullet. Activated charcoal is not effective for certain things. Heavy metals like lead, for example, corrosive agents, alcohols, petroleum stuff, salts, nitrates, most electrolytes. It just doesn't bind them well.
Okay, so charcoal is key, but has limits. What about trying to speed things up, get the toxins out faster once they're in the gut?
Yeah, that's where cathartics come into play. These are things that speed up how fast stuff moves through the gastrointestinal tract. The idea is to reduce the time the toxin sits in the gut where it can be absorbed and just push it out faster.
What kind of things are used?
Saline cathartics are common, like sodium sulfate or magnesium sulfate. Sometimes they're even mixed in with the activated charcoal slurry. Mineral oil is another option, particularly for toxins that are fat-soluble.
But there are warnings here too, I imagine.
Definitely. You have to be cautious. You wouldn't use them if the horse is already dehydrated or if they have diarrhea or if there are signs of colic or ileus. That's where the gut motility slows right down. And also, if the toxin itself is causing really bad dehydration or messing up electrolytes, adding a cathartic could make things worse. So vet judgment is key there.
Now, for something that really sets horses apart from, say, dogs or even people in this context,
Yeah.
what about making them vomit, inducing emesis?
Ah, yes. The million-dollar question, can horses actually vomit? And the answer unequivocally is no. They physically can't. Not effectively, anyway. So emetics, drugs that make you vomit, are generally a huge no-no. They're not recommended, often strongly contraindicated in horses.
Why is that? What are the risks?
The risks are massive. Trying to force it carries a very high danger of aspiration, pneumonia, breathing stomach contents into the lungs, also esophageal rupture, tearing the tube going down to the stomach, and just severe distress for the horse. This is absolutely critical knowledge for anyone who owns or cares for horses. Don't try to make them vomit, period.
Okay, crystal clear on that. So we've covered decontamination, but what about specific antidotes? You know, like in the movies where there's one shot that fixes everything.
Yeah, it's a common idea, but the reality in toxicology, especially equine toxicology, well, specific antidotes are available for only a really small number of toxins. They're quite rare, unfortunately. Now, if one is available and the vet is confident in the diagnosis, then yes, it should absolutely be used. Our sources list a few examples. Things like atropine sulfate and pralidoxim chloride, 2PM they call it, for certain pesticides like organophosphates or carbamates, sodium nitrite and sodium thiosulfate for cyanide poisoning. Just plain oxygen therapy is the antidote for carbon monoxide. Methylene blue for a specific blood issue called methemoglobinemia, which you can see with things like red maple toxicity. Vitamin K1 is crucial for anticoagulant stuff found in moldy sweet clover or some rodent poisons. And N-acetylcysteine, or NAC, for the rare case of acetaminophen Tylenol poisoning in horses.
So a few specific tools, but limited.
Exactly. And it's really important to stress, antidotes themselves can be harmful if you give them for the wrong thing or if the diagnosis isn't certain. So vets use them very, very cautiously, only when it's clearly appropriate.
Right. So given that these magic bullets are pretty rare, what's the real core of treatment? What's the main strategy when dealing with equine poisoning?
The absolute mainstay of treatment is what we call symptomatic and supportive care. This is, without doubt, the most crucial part. It's all about managing the signs the horse is showing the symptoms and supporting their body's own functions, helping them cope while the toxin is cleared out or metabolized.
What does that involve practically?
Oh, it's multifaceted. Fluid therapy is almost always essential. For dehydration, correcting electrolyte imbalances, keeping the kidneys flushed and working well, maintaining renal perfusion, and just general cardiovascular support. Pain management is often needed, usually NSAIDs like flunixin, Banamine, or phenylbutazone, Butez, sometimes opioids for severe pain, but again, used carefully. Then there's managing the gut, maybe gastroprotectants like omeprazole or sucralfate to coat the stomach lining, sometimes drugs to help get the gut moving again, prokinetics, or laxatives if needed.
What about neurological signs like seizures?
Yeah, controlling those is vital. Medications like diazepam or phenobarbital can be used, and just as important is protecting the horse from injuring itself if it's down, or thrashing, padding the stall, that sort of thing. Respiratory support might be needed oxygen, maybe bronchodilators to open airways, sometimes antibiotics if there's a secondary pneumonia. And then specific support for organs that might be hit hard, like the kidneys or liver, often involving aggressive fluid therapy and other targeted measures. And don't forget nutrition. If the horse isn't eating for a while, that becomes critical. Sometimes that means feeding through a nasogastric tube.
And all through this process, it sounds like constant observation is key, right?
Right.
Just watching them closely.
Absolutely. Continuous monitoring, watching their vital signs, their neurological status, how much pain they seem to be in, what's coming out, urine, manure, plus regular lab work, checking blood counts, biochemistry, maybe urinalysis to see how the organs are coping and how the horse is responding to treatment. Honestly, the type, the duration, the intensity of the supportive care, combined with giving them the best possible environment to recover, that is most often what makes the difference between life and death.
So that leads to the diagnostic challenge. How do vets figure out what specific poison it might be, especially when, as you said, the signs can look like so many other diseases?
It really is like assembling that giant puzzle we talked about earlier. It's tricky. Getting a definitive diagnosis usually needs a combination of things. First, a really complete history from the owner or caretaker. Then, a thorough physical exam of the horse. And then, often, specific diagnostic tests. And about that history. It's worth mentioning, clients sometimes, understandably, might be feeling guilty or already suspect something specific, which can sometimes unintentionally bias the information. So the vet needs, a gentle touch to get all the crucial details.
What kind of details are most helpful?
Oh, things like, are other animals potentially exposed or affected? Has the horse had any previous health issues? When exactly did the exposure likely happen? How did it happen? And if there's a product involved, getting the full name, the manufacturer, even lot numbers off the label can be incredibly useful.
Okay, so history and exam are the starting point. What about lab tests and other diagnostics?
Lab tests are often super helpful. Standard blood work, a CBC and biochemistry panel, and a urinalysis give a good baseline picture of organ function and overall health. For actually confirming a specific toxin, though, you need specific samples sent for toxicology testing. From a live horse, that's usually whole blood, serum, and urine. If it's a post-mortem situation after the horse has died, then samples like liver, kidney, brain tissue, fat, urine, and gut contents are often collected.
And there's a really important point about handling those samples, isn't there? Something you absolutely need to know if you're collecting them.
Yes. This is crucial. Samples intended for toxicology testing, basically trying to find the poison itself, need to be frozen. The only common exception is whole blood in certain tubes. Do not put them in formalin. Formalin is for preserving tissues for histology, looking at cell structure under a microscope, which is different. Freezing preserves the toxin itself for analysis. Seriously, always call the diagnostic lab first. Ask them exactly what samples they need and how they want them handled and shipped. So many potential issues can be avoided just by following their specific protocol. Incorrect sample type or poor storage are common reasons tests fail.
Got it. Freeze the samples. Call the lab. Now, thinking about the outcome, are there things beyond just what poison it was that affect how the horse does? Risk factors.
Oh, absolutely. That's a really important question when thinking about prognosis, the likely outcome. The result isn't just about the toxin. It's influenced by a whole bunch of risk factors. Some are related to the toxin itself. How inherently poisonous is it? What form was it in solid, liquid, powder? How much did the horse get the dose? And how were they exposed, eaten, skin, etc.? Then there are factors specific to the individual horse. Their age, younger horses sometimes eat things older ones wouldn't. Breed can play a role. Sex, whether they're pregnant or lactating. Their nutritional status, their weight, any pre-existing health problems, other medications they're on, all that matters. And finally, don't forget the environment. Things like the season, different plants grow at different times. Drought conditions can force horses to eat things they normally avoid. Ambient temperature, even agricultural practices or how the property is managed. All these things interact and can influence whether poisoning happens, how severe it is, and ultimately what the chances of recovery are.
Which brings us, naturally, to prevention. We always say it. An ounce of prevention is worth a pound, maybe even a ton, of cure here. So what can you, the listener, actually do to stop equine poisoning from happening in the first place?
Yeah, connecting back to the bigger picture, prevention is always the best approach. It's the most effective strategy by far. Let's break it down. First, toxic plant management. This is huge. You've got to know your plants. Educate yourself, educate your staff about common toxic plants in your area, your region. Then manage your pastures actively, walk them regularly. Remove toxic plants, ideally hand pulling, making sure you get the roots out. Herbicides can be an option, but use them very carefully, follow all instructions, or simply fence off areas where those problem plants grow.
And what about hay? That's a big one.
Crucial point about hay. You absolutely must inspect your hay for toxic plants. Why? Because many toxins stay potent even when the plant is dried. Drying doesn't necessarily make them safe. Also, avoid overgrazing your pastures. When grass is scarce, horses are more likely to try eating less palatable things, including potentially toxic weeds, and make sure they always have enough good quality feed and forage available, especially during dry spells or winter, so they aren't tempted to nibble on things they shouldn't.
Okay, plant management is key. What else?
Chemical and drug storage. This is non-negotiable. All pesticides, herbicides, fertilizers, medications, everything needs to be stored securely. Locked away, clearly labeled where horses absolutely cannot get to them. Follow labeled directions to the letter for application rates and especially for grazing restrictions after treating a pasture. And be super careful that feed and water sources don't get contaminated, from spray drift or runoff.
And general management practices.
Yeah, just good general horsekeeping. Know who supplies your feed and hay, make sure they're reputable, always provide access to clean, fresh water. And supervise your horses, especially if they're new to an area or you introduce a new horse to the herd. Just be observant.
So it really boils down to being informed, being proactive, and just being diligent about managing their environment, doesn't it?
Exactly. That awareness and diligence can truly make all the difference.
Well, we have certainly taken a deep dive today into the often complex and concerning world of equine poisoning. We've covered that immediate emergency response, the critical steps in decontamination, the nuances of supportive care, and that absolutely vital role of prevention.
We have, and we've seen that while those specific magic bullet antidotes are pretty uncommon, acting quickly, being informed, and providing dedicated, thorough, supportive care, that's really what's paramount for a good outcome.
It's definitely a scenario no horse owner ever wants to face. It's frightening. But hopefully, armed with the knowledge from this deep dive, you feel much better prepared.
Absolutely. And perhaps as a final thought for you to consider, how might taking a closer look, a really specific look, at the environmental risks, the plants, the layout, and the management practices unique to your own farm or boarding situation, how might that understanding help you better protect your horses from these hidden dangers?